Demonstration of cranial nerve assessment. Cranial nerve 1, olfactory. Check the patient's nostrils are clear, occlude each nostril in turn, and introduce a distinctive odour for the patient to identify. Can I just check inside your nose? Stick to block the nostril. Tell me, what can you smell?
Orange.
Tell me what you can smell.
Vanilla.
Cranial nerve 2, optic. Test visual acuity using a Snellen chart. Test visual fields by confrontation. Test direct and consensual pupillary response. And use fundoscopy to check for any papilledema or swelling of the optic disc. Visual acuity using the Snellen chart. Stand the patient 6 metres from the chart and wearing the normal contact lenses or glasses, ask them to occlude one eye at a time and read down the chart as far as they can. You cover your right eye and read as far as you can down the chart.
OYTAXUHYVXHOYTOUVA.
Repeat this test for the other eye. Assessing visual fields by confrontation. Sit facing the patient, have them occlude the opposite eye to yourself, and assess the visual fields in all 4 quadrants. Cover your eye. Keep looking at me and tell me how many fingers you can see me moving.
2, 4, 1, 2.
And repeat for the other eye. Test direct and consensual pupillary response. Just look straight ahead for me. Use fundoscopy to check the optic disc for any signs of swelling. Just keep looking straight ahead. And repeat for the other eye. Cranial nerve 3, oculomotor, cranial nerve 4, trochlea, and cranial nerve 6, abducens, are tested together. Assess these by looking at the range of movement of the eyes, asking the patients if they experience any double vision, and observing for any ptosis, nystagmus or squint. Keep your head still. Follow my finger with your eyes. Tell me if you see any double vision. Cranial nerve 5, trigeminal, and cranial nerve 7, facial, can be tested together. For the sensory component, ask the patient to shut their eyes and test the forehead, chin and cheek in a random order, asking them to identify where you're touching. Close your eyes, and if you point to which part of your face I'm touching. The motor component can be assessed by observing the face for any asymmetry through a range of movements. Clench your teeth, feeling for strength of the jaw. Open your mouth slightly and don't let me close your jaw. Push your chin against my thumb and against my finger. Okay. Lift your eyebrows up and close your eyes tight. Don't let me open them. Puff your cheeks out, showing your teeth. Also demonstrate the technique of doing a corneal reflex, which involves these two cranial nerves. This will not be assessed in OSCE, but you need to mention it. Approach the patient from behind with a wisp of cotton wool. Gently draw it across the cornea without touching the eyelashes. It should elicit a blink. Cranial nerve 8, vestibulocochlear or auditory nerve. This nerve has functions of balance and hearing. You would assess the patient's balance if you were concerned about their gait as they walked in. You'd observe them walking heel to toe or perform a Romberg test. To assess hearing, use the whisper or rub test. Make a quiet noise behind one of the patient's ears and ask them to identify which ear they can hear with. Repeat for both ears. If there is any discrepancy between the two ears, you can go on to perform Weber and Mini tests. Close your eyes for me. Tell me which ear I'm making the noise behind.
Left. Right.
Does it sound the same for both ears?
Yes.
Cranial nerve 9, glossopharyngeal, cranial nerve 10, vagus, and cranial nerve 12, hypoglossal can be tested together. Listen to the patient's voice for any hoarseness, observe for any difficulty swallowing. I will also demonstrate the gag reflex, although this will not be tested in the OSCE. Check that the uvula is central and rising and falling in the midline, and assess tongue strength and symmetry. I'm going to ask you to swallow. Okay. And open your mouth for me. I'm just going to gently touch the back of your throat. Open your mouth again. And just say ah. Stick your tongue out and say ah. Just watching the uvula rising and falling in the midline. Get you to stick your tongue out again. And put your tongue in your cheek. To one side, push against my ear, and to the other side. Cranial nerve 11, spinal accessory nerve. This is tested by assessing the muscle strength of the trapezius and sternocleidomastoid. Ask you to turn your head against my hand. Same on the other side. And shrug your shoulders up and don't really push them down. That completes the cranial nerve assessment.